Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the treatment of corns and calluses. In this presentation, we'll talk about what are corns and calluses. We'll discuss non-pharmacologic treatment, or things you can do besides medication to help ease the pain of corns and calluses. And then we'll finish it off with pharmacological treatment, or medications that can be used in treatment. Before I get into the presentation, just as always, keep in mind that this information is for information purposes only and not to be used as a source for recommendations for your personal health care. And with that, let's jump right into it. So first here we'll discuss corns and calluses. So corns and calluses occur when keratinization becomes overactive in an attempt to protect the foot from excessive friction or pressure from the skin rubbing against bony areas of the foot. Poorly fitting footwear can lead to the presence of corns and calluses by placing pressure on bony areas or causing excessive friction. Calluses may also form as a result of weight gain, abnormal gait, or foot structure. Corns and calluses are not contagious and are observed in most age groups. Corns appear as a tough layer of compacted, dead skin cells, which may have a central cone over the bony area or spur. The affected area may also be yellowed. Hard corns favor the areas over the fifth toe joint and on the soles of the feet, while soft corns are found between the toes. Hard corns may be confused with plantar warts. A soft corn is essentially a hard corn that has absorbed moisture from sweat, becoming macerated. Soft corns are often confused with athlete's foot, although they are more painful, while athlete's foot is itchy. Calluses have similar appearance to corns and tend to be well defined, often occur on soles of feet, the heel, or ball of the foot. Now for some non-pharmacologic therapy. So identifying and removing the cause of the lesion is the most important step in the treatment of corns and calluses. In addition to self-examination of the feet, persons with specific medical conditions such as diabetes should be examined by a health practitioner with foot care expertise at each office visit and at least annually. The most common intervention is a change in footwear, and this is often the only treatment required. Orthotic devices may be inserted into footwear to provide arch support and to distribute body weight more evenly so that the excess pressure is removed from the affected area of the foot. Devices such as cushions, felt pads, and latex foam can be used to protect a corn or callus. A variety of shapes and sizes are available. Custom pads can be constructed from moleskin or lamb's wool. Placing lamb's wool between the toes affected by a soft corn decreases the pain. Debridement of a corn or callus using a pumice stone can be performed after soaking the area in warm water for about 10 minutes, with or without sodium bicarbonate or baking soda. Excising corns with electrosurgery may result in superior pain relief at 6 months compared to standard sharp debridement with a scalpel. Now for some pharmacologic therapy. So salicylic acid in concentrations of up to 40% is available in self-treatment of corns and calluses. Although various concentrations of salicylic acid appear to be successful in treating corns and calluses, there is no strong evidence for their effectiveness in treating these foot conditions. Salicylic acid concentrations of 12 to 40% may be indicated if the cause of the lesion is not easily corrected, or if the patient is too uncomfortable to wait for the lesion to regress once the cause has been removed. Plasters and pads tend to adhere to the lesion better than liquid dosage forms. Salicylic acid will damage normal skin, so it is important that it is not to be applied outside the edge of the corn or callus. Liquid collodion vehicles should not be used by the elderly due to a risk of poor vision, or by children due to the potential for poisoning by ingestion or inhalation. Now for some examples here of pharmacologic therapy. So salicylic acid, 12 to 17.6% liquid, which would be Compound W, Soluver, or others. So you would apply this medication daily or twice daily as needed for up to 14 days. Some side effects people may experience would be excessive burning or irritation. Now for tips, do not apply to broken, infected, or irritated skin. Wash hands after use, and avoid direct eye contact. Now, salicylic acid, 12 to 40% pads and plasters, which would be Compound W or Soluver Plus. Apply medicated plaster and leave in place for 2 days. Repeat every 2 days for up to 14 days. Side effects here would be the same in excessive burning and irritation. And tips: do not apply to broken, infected, irritated skin. And again, wash hands after use. Alright, that's all we're going to talk about today with the treatment of corns and calluses. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.